With no further ado, it's my great pleasure to welcome this morning's speakers, Joyce Vogelgesang and Moyra McAllister, to our presentation, Supervision of Physiotherapist Interns. Joyce Vogelgesang is the Deputy Director at Physiotherapy Alberta. She oversees the areas of conduct, continuing competence, and registration. Joyce has over 25 years of experience working in the physiotherapy regulatory community, both at the provincial and national level. Moyra McAllister is Physiotherapy Alberta's Complaint Director, and prior to taking on the role, Moyra was a practicing physiotherapist, clinic owner, and clinic director for over 25 years. And myself, Leanne Loranger, I'm the Manager of Policy and Practice at Physiotherapy Alberta and was previously the Practice Advisor. We realize that we probably have a bit of a mixed audience with current physiotherapy interns, new physiotherapist intern supervisors, and experienced physiotherapist intern supervisors joining us this morning. The presentation is focused on the supervisor role and expectations, but there's time at the end if there are questions from any of our audience members, and we certainly are hoping that if any of our experienced supervisors have burning issues or challenging situations that they've encountered in the past, we'd love to hear from you and discuss those situations. I also would like to highlight that the focus of today's presentation is on the supervision of physiotherapist interns. This includes both recent graduates of Canadian entry to practice programs and internationally educated physiotherapists who may or may not have worked clinically before moving to Canada, but who are new to practice in Canada. While we recognize that physiotherapists may also supervise physiotherapy students or support personnel, the appropriate supervision of each of these groups will differ slightly due to the background, education, and skills of each. Our plan for this morning's presentation is that I will be speaking about the expectations for supervisors and physiotherapist interns and how to go about meeting those expectations. Joyce will be speaking about the reasons for the supervision requirement and the requirements related to supervision agreements, and Moyra will be providing a complaints and conduct perspective on the supervision of physiotherapist interns. And then, as I said already, we'll close by taking questions from the audience. To start with, Moyra is going to present a scenario that we'd like you to consider as we go through this presentation.
Good morning. Without a doubt, there are many benefits to agreeing to become a supervising physiotherapist for a physiotherapist intern. There are often challenges in that agreement as well. I'm going to lay out a challenging scenario, and throughout the talk this morning, we'll be addressing each of those challenges and hopefully providing you with some means to address those challenges. So here's the scenario. You are a supervising physiotherapist for the following individual: a physiotherapist intern who is foreign trained and who had practiced for a number of years in their country of origin. They've been hired to work in a rural facility, or are being hired. There's no on-site supervision possible. It's a sole charge PT placement. You are 30 minutes away by car. You work part-time 3 days a week. The documentation in your facility is in paper format. There's a severe shortage of physiotherapists and limited access to physiotherapy in the area. Your employer has directed you strongly that you must sign the supervision agreement in order that they can hire this individual. So there's a bunch of issues that you need to contend with as a supervisor, and as Leanne said, if you can just keep that in the back of your mind, and we'll come back to that at the end of the talk.
Knowing why supervision is required will go a long way to understanding the expectations Leanne will discuss later in this presentation. Physiotherapy Alberta's mandate as a regulator is to protect the public interest. Our job is to license qualified, competent physiotherapists to provide services to Albertans. Successful completion of the physiotherapy competency exam is a registration requirement for all first-time registrants. First-time registrants who have completed all registration requirements, with the exception of the physiotherapy competency exam's clinical component, are eligible for registration on the provisional register with the condition that they practice under supervision. Physiotherapy Alberta's position is that with the appropriate level of oversight, the public is protected, even though these individuals have not completed the final requirement for registration on the General Register. By taking this position, Physiotherapy Alberta is balancing protection of the public with access to services by allowing physiotherapist interns to enter the workforce. The supervision requirements and expectations we will discuss in this webinar are all based on the need for safe, quality patient care.
So supervision versus mentorship. Often when Physiotherapy Alberta fields calls from members, they begin the conversation or the question by saying, I'm mentoring a physiotherapist intern. And while it may be true that you're mentoring a physiotherapist intern, what Physiotherapy Alberta is concerned about is the supervision of that intern. And you might be wondering to yourself, well, what's the difference? There are some important distinctions, however. Mentorship is considered, or is often considered, a long-term relationship that supports both personal and professional growth. Mentors can be external or internal to the work environment. They engage in reciprocal learning, they share knowledge, and they may provide feedback to the mentee. But mentors do not typically provide formal evaluation of the mentee. In contrast, a supervisor has an explicit requirement to evaluate the competence and performance of the intern to ensure that safe practice occurs. Language matters. It is a mindset.
So while the physiotherapist is the physiotherapist intern is a regulated member and on the provisional register, and they are the most responsible physiotherapists delivering care to the patient, and therefore they are accountable and responsible for their actions and inactions. The physiotherapist supervisor also bears some accountability and responsibility in ensuring that the patient assignment and the proposed treatment plan are appropriate. So what's in it for me? That's everybody's favorite FM radio station, I was told. WIFM. WIIFM? Anyway, what's in it for me? There are many, many benefits to agreeing to take on a physiotherapist intern. Staff recruitment. It's a great way to find new staff, and you really get to know their skills and areas for development in this area of supervision, in this time of supervision. It's great for your own personal professional development as well. New grads have a wealth of current knowledge about physiotherapy practice, evidence to support practice, and emerging trends and techniques. Foreign-trained physiotherapists often come with a broad spectrum of professional experiences. And the last, and as important, is service to the profession. Somebody did it for you. This is a way to support the future of the profession and the sustainability of the profession, and to give something back to your profession.
So when we think about the expectations around providing supervision, you can go to the standards of practice and the standard of practice related to supervision, which states, and I am quoting directly from that standard, that the physiotherapist is responsible and accountable for the physiotherapy services provided by personnel working under his or her supervision. In other words, their supervisees. The expectations are that the physiotherapist assesses the knowledge and skills of supervisees and assigns only those tasks and activities that fall within the supervisee's competence. They employ supervision strategies, both direct and indirect, to maintain client safety and the provision of quality care, which take into account the competence of the supervisee, the client care needs, and other factors related to the practice environment. They establish ongoing communication processes with supervisees, and they monitor and evaluate the delivery of services by supervisees. Keep in mind that supervision can last a few months or many months, depending on where the intern is in the exam process. This is something that should be considered at the outset when you're deciding how you will provide supervision until that intern no longer requires it. So those were the performance expectations from the standards of practice, but sometimes it's a bit of a jump from the standards to what real life looks like. So what do we mean, or how can you go about meeting the expectations that we've just listed? Well, there's a few things. So first off, there's a period of direct supervision, which we'll talk about at length. There's some activity to determine what appropriate assignments will be. There's a supervision plan that we recommend. There's a need for ongoing monitoring in either direct or indirect supervision. and special considerations around supervision of restricted activities, which we'll talk about further. It is competence dependent, and it is relationship dependent as well. And I just want to clarify, when Physiotherapy Alberta uses the term competence, what we mean is having the knowledge, skills, and attitudes to perform an activity or provide a service. So when we say that supervision is competence dependent, what do we mean? Well, it has to be recognized that different physiotherapist interns will have different skills and different individual competencies. While the successful completion of an accredited physiotherapy program helps with the consistency of competence, it's not assured that physiotherapist interns will have equal competence in all areas. The supervisor needs to understand that physiotherapist interns will have had differing experiences and clinical exposures during their program, and therefore inherently different understandings and integration of the information they've been taught. The supervisor needs to evaluate the person in front of them and their individual competence. Now, what do we mean by relationship dependent? Well, as a supervisor, if a physiotherapist doesn't have confidence in the physiotherapist intern's ability to perform a task, including confidence in their ability to recognize when they need the supervising physiotherapist's help, then they can't assign that task. Let's talk a little bit more about that initial period of direct supervision, and not to overstate the point, but just as not all physiotherapists are created equal, not all physiotherapist interns are created equal. So again, you need to evaluate the knowledge, skills, and attitudes of the physiotherapist intern within the context of the practice. And that means within the setting, within the context of the supports that are in place, and with regards to the patient populations and range of conditions that your intern, the intern, will be serving. There's no set time period for this period of direct supervision. It needs to be sufficiently long for the physiotherapist to know what they can and cannot safely assign to the intern, and to determine the types of supervision that they'll employ, and to formulate the plan. When I think about assignment of services to supervisees, I think about assignment of services to students, to TAs, and to interns. And I can say that really honestly, when I worked in clinical practice, I didn't often think in terms of assigning tasks to physiotherapist interns. But by virtue of saying this intern is good to go and ending the period of direct supervision without putting restrictions on their practice, what a supervisor is essentially saying is that they've assigned that intern anything and everything that comes through the door. In reality, with students, we tend to cherry pick good cases for the student to learn from. But when a physiotherapist intern enters practice, which may only be a few short weeks after that last clinical placement, they're often suddenly considered to be our colleague, and we may fail to coach and support them and their continued professional development, or to think carefully about what is or isn't being assigned to them. We have to remember, as supervisors, it's not a switch that just got flipped overnight. So, assignment of services. Again, we're relying on our members to meet their end of the deal. The supervisor's not just a supervisor in name. They need to consider the competence of the intern they're working with and act accordingly. If the intern lacks skills in a certain area or related to a specific patient population or diagnosis, then the supervisor must act to protect the public, either by limiting the assignment of that patient type or by providing direct supervision until the intern develops the skills necessary to work with that patient group with indirect supervision. And once again, language matters. Another common statement that I hear when people call talking about physiotherapist intern supervision is, my intern is independent, or until my intern is independent. Your intern's not independent. Just nope, full stop. Your intern may be performing really well and may be able to practice with indirect supervision, but by the very virtue of the fact that you have a supervision agreement in place, they are not independent. So then how can you go about supervising a PT intern? This slide, again, is taken directly from our supervision guide, and it shows the many routes and methods of supervision and when they might be appropriate. So, for example, direct supervision must be used for that initial period of supervision and that initial evaluation, but also can be used subsequently if required, and is always used for when supervising the practice of basic restricted activities. Chart auditing is another option, and it can be used for ongoing monitoring of practice, to assess how the physiotherapist intern is progressing patient care, and to evaluate the intern's clinical reasoning. And similarly, meetings or supervisee discussions are another way to monitor performance, assess the progression of patient care, and evaluate clinical reasoning. So what about that supervision plan? First off, keep in mind the supervision plan is between you and the intern. You don't need to send this to Physiotherapy Alberta under usual situations. It does demonstrate that you're more than a signature and establishes some clear expectations. The purpose is to demonstrate to Physiotherapy Alberta that you're fulfilling your supervision obligations, taking those responsibilities seriously. It may also become relevant in the event that a complaint is lodged against your physiotherapist intern. It removes any doubt in anyone's mind, both the supervisor and the intern, about how to proceed or how you're going to proceed through this period of supervision, and the parameters around the supervisees, the intern's practice. Having a formal plan also establishes a method and a way to engage in future evaluations of performance, discussions about skills and areas of development. It also helps to keep in mind that physiotherapist interns, over the course of their supervision, will likely progress, and so your supervision plan will change over time and the strategies that you use. There are some frequently asked questions that we encounter. Where does it live? How long do I keep it? And what should I include? So again, this is not a patient record. It should be kept securely somewhere other than patient files. In fact, I would suggest that this is really a personnel file. There are no retention rules from Physiotherapy Alberta about this. It should be considered private employee information and therefore governed by PIPA. And PIPA requires that you retain a record for as long as reasonably necessary to fulfill the purpose for which the record was created. Moyra, did you have something you wanted to add?
Sure. So from a conduct perspective, your plan is essentially like your patient treatment chart. It's your hard evidence that you provided adequate supervision to the supervisor and adequate supervision to the physiotherapist intern. To give you a bit of context, though, it would be unusual to have a complaint submitted greater than 2 years post-incident. So I would suggest that a minimum of 2 years you keep the paper copy or electronic copy of the supervision plan. However, there is no time limit for the submission of a complaint. So if you want to err on the side of caution, you might want to keep it indefinitely, or as long as you keep personnel files or your organization keeps personnel files.
Okay. In terms of what to include approved assignments, those assignments that require direct supervision and those requiring indirect supervision. Identify the supervision methods that you're going to use. Discuss the frequency of the meetings or follow-up appointments, the frequency of reevaluations, and what that physiotherapist intern should do in an urgent situation. In fact, I'd suggest that's one of the most important pieces of information there. What's the backup in extenuating circumstances? What to do if a patient situation arises that the intern doesn't know how to address. I'd also like to remind you, although it seems a little out of context perhaps to say this here, but it's not Physiotherapy Alberta's expectation that supervisors ensure the intern passes the competency exam, the PCE. From a regulatory perspective, the plan and supervision as a whole should focus on protecting the public. It's not about helping the intern to study.
So if you're asked to be a supervisor, you can expect to sign a supervision agreement. There are 3 parties to the supervision agreement. The intern, who agrees to comply with the supervision condition on their practice permit. The supervisor, who agrees to adhere to the supervisor responsibilities that Physiotherapy Alberta has determined are necessary to ensure the delivery of safe, ethical, and effective physiotherapy services provided by the intern. And also Physiotherapy Alberta, who issues a practice permit based on the intern and the supervisor's agreement to adhere to their respective responsibilities. The Supervision Agreement is more than just a piece of paper. Physiotherapy Alberta must approve all supervision arrangements. This involves ensuring there is a supervision agreement on file and approved for all practice locations where the intern provides services, that the supervisor is a member on the general register, that the intern and supervisor practice at the same location. And we also take into consideration the supervisor's conduct history, both present and previous, as well as the number of interns the supervisor is currently supervising. Now, physiotherapy does not have a rule that limits the number of interns a supervisor may supervise at one time. We acknowledge this may vary depending on several factors, for example, the supervisor's caseload, supervisor's role, and even the number of interns requiring direct versus indirect supervision. However, if you are supervising more than 2 interns at one time, you can expect a call from Physiotherapy Alberta staff to discuss how you're meeting your supervisory responsibilities. The number one question registration staff receive is, does the physiotherapist intern need to practice at the same location that I do? And the answer is yes. Let's just go back to Leanne's slide on what to expect for a minute to illustrate why this is. So the period of direct supervision obviously requires both parties to be at the same location at the same time. And you can see that ongoing monitoring can include both direct and indirect supervision. Now, while some strategies may be implemented off-site, others will require on-site access. For example, access to patient records for chart audits or chart-stimulated recall discussions, or even access to patients and colleagues for discussions. As well as supervision of restricted activities also requires that the supervisor is physically present and on-site. The supervisor may not necessarily have their own caseload at the practice location, but they do need to be employed, contracted, or otherwise able to be on-site and have access to the intern, patient records, and other parties. If you find yourself going to a location where you would not normally practice, you will need to update your member profile to show this new practice location. If you're only there to provide supervision, then indicate you are there in an administrative role. And the second most popular question is, may the physiotherapist intern have more than one supervisor at the same time? And the answer to this question is also yes. Physiotherapy Alberta will require a supervision agreement from all parties, and the supervisors will need to communicate and collaborate in the provision of supervision. Examples of when this would happen would be if the supervisors work part-time or if the intern is working at more than one practice location.
So some other questions to consider that are perhaps not requirements, but important considerations or factors are, who is the best person to supervise the intern, and what about conflict of interest? When we think about the best person to supervise a physiotherapist intern, that would depend on who else is in the practice environment. If you're a sole charge PT, you might be it, but if there's other options, then look at them. There's contextual factors around what's going on in the practice environment and in the lives of those who are in the practice environment. There's also personality factors, caseload demands, and work experience. Take a moment to consider if you're ready to be a supervisor of a physiotherapist intern and if you're the best person for the role. What supports will you need in order to do the job well? When it comes to conflict of interest, you should consider situations where you have a close personal relationship with the physiotherapist intern. Maybe they're a relative, a spouse, or a close friend. While it's not strictly prohibited for you to supervise someone with whom you have a close personal relationship, it's certainly not the best case scenario, and it is a situation that's rife with potential challenge. Physiotherapy Alberta would encourage you to find an alternate supervisor if one is available.
So we get back to accountability of provision of services. As I said previously, the physiotherapist intern is a provider of the service and is responsible for the services that they deliver and the appropriateness of those services. However, the supervisor retains responsibility for the assignment of tasks, the appropriateness of the assignment, and for providing adequate supervision. Supervision in some form is a requirement of Physiotherapy Alberta Standards of Practice while the individual remains on the provisional register. And as we've stated many times, the supervision can be direct or indirect. Oh, the burning question, what happens if something goes wrong? Which it can and does. Again, from a conflict, I have a very narrow focus. From a conflict perspective, or a conduct perspective, it depends on the nature and the severity of the complaint or the incident or the adverse event. The consequences for the intern, it could mean an increase in the frequency and degree of indirect supervision. It could mean a return to direct supervision for some or all of their physiotherapy activities. It could mean removal of the supervision agreement, and that can be by either of the other two parties. If that happens, that individual is no longer allowed to practice until a new supervision agreement is in place. PT Alberta can withdraw their agreement in the supervision agreement. It could lead to a formal investigation and ultimately to a hearing process, hearing tribunal. In the worst case scenario, if the individual were found guilty of unprofessional conduct at a hearing tribunal, they could lose the ability to be licensed before they're actually even on the general register. This is a very extreme situation. For the supervisor, it could mean an increase in the time commitment to supervise that physiotherapist intern, both indirect and direct. It may be being required to be a witness in a formal investigation and potentially a hearing tribunal. And something to consider when you're looking at your responsibilities is it could ultimately result in a formal complaint against the supervisor for not meeting their supervision requirements as outlined in the standards of practice. That's very unusual, very, very, very unusual, but it is a potential.
Thanks for highlighting that. That's unusual. So for the next few slides, we're going to talk about some real-life scenarios we've encountered or heard about at Physiotherapy Alberta. So scenario number one, the physiotherapist intern has failed their first attempt at the clinical component of the PCE. What now, Joyce?
Well, failing the clinical component the first time, and by first time I mean any time, whether the individual was registered in Alberta at the time of failing the exam or elsewhere, does not impact the intern's registration, provided they have been on the provisional register less than 2 years.
When you find out that the intern you're supervising has failed the clinical exam on their first attempt, the next question is, what does it mean for how you provide supervision? And there are a couple of options. First thing you need to do is consider if this is new information. Did you anticipate it? Are you surprised? I can think of a specific scenario where a physiotherapist intern failed the PCE and it was a true shock. The intern was an excellent clinician, and on the day in question, I'd suggest they just had test anxiety. At least that's what I chalked it up to. They ended up passing with flying colors on their second attempt. In this situation, their test result did not match what I was seeing in practice, so I didn't change my strategy for supervision. On the other hand, if you're not surprised by the results, you may want to reevaluate the supervision plan in light of the exam outcome. Ask yourself, are you providing appropriate supervision? Are you protecting the public? Do you need to revise the plan or provide increased supports to take into consideration the intern's exam outcome? Scenario number two, also a very common scenario. I'm going on vacation. Does my intern need to get a new supervisor and submit another supervision agreement? And the answer is it depends. It depends on the competence of the intern, the length of the vacation, and the comfort level of the supervisor. If the intern's doing really well with indirect supervision and your vacation is going to be brief, it may be perfectly fine to carry on without a second supervisory agreement. What you should do is have a case discussion before you leave and another one when you return. You probably also need to have some form of an informal agreement and a plan for what the intern should do in the event that something unexpected happens and the intern needs additional support. In other words, a backup person they can contact. However, if there are performance concerns or if the vacation is going to be extended, it would be appropriate to get a second supervision agreement in place. Similarly, if the supervisor is uncomfortable about retaining their supervisory responsibilities while they're away on vacation, they should also get a second supervisory agreement. Scenario number 3, which sort of harkens back to Moyra's story earlier. I'm the only physiotherapist in a 50-kilometer radius. My employer is telling me that I need to make supervision work so that they can hire a new PT intern. I'm feeling pressured. What do I do? Well, clearly it's not great that you're feeling pressured to take on supervision. It is good that you're showing that you're giving it some thought instead of just simply agreeing. It suggests that you're not just going to be a signature. Some suggestions we have from Physiotherapy Alberta. First off, convey what the responsibilities of supervision are to your employer. What do you need to do? Make sure they understand that. You can also suggest that they call Physiotherapy Alberta's practice advisor directly for clarification and to further understand the responsibilities you have and what needs to happen to make supervision work. We'd also suggest that you advocate for the supports that you need to make it work. Does that mean some additional release time from clinical care so you can provide supervision? What do you need? Advocate for what that is. Scenario number 4. It's not working out. I'm going to have to withdraw from the supervision agreement. What now?
Well, what you should do is contact Physiotherapy Alberta. So you may discontinue a supervision agreement at any time, but you are obligated to inform Physiotherapy Alberta if you do. There are 3 typical scenarios that we've encountered. The first is when there are no performance concerns, but the work of supervising or personality issues means you want to withdraw. The second is when you may have performance concerns which you have not been able to resolve despite your best efforts. And the third scenario is when the intern is being terminated from their employment for reasons of unprofessional conduct, incapacity, or incompetence. In the first scenario, where there are no performance concerns, you must notify Physiotherapy Alberta of your decision, but we do not need to know the reason why. Keep in mind, though, that withdrawing a supervisor will have implications for the intern's employment, so you should make sure the intern and your employer are aware of your decision in advance. The intern will not be able to practice from the time you withdraw a supervisor until Physiotherapy Alberta receives and approves a new supervision agreement. In the latter scenarios where there are performance, conduct, or competence concerns, you have a duty to tell Physiotherapy Alberta you're withdrawing a supervisor and also the reason why. This is part of the protection of the public responsibility that the college and members share.
So if as a supervisor you have concerns about a physiotherapist intern's ability to meet the standards of practice, and you or your employer, and I'll use you, but that is understood that it's you and or your employer, choose to terminate the intern's employment due to the concerns, you are obligated under the Health Professions Act, Section 57, to report this to the college. And if failure to report this type of instance to the college can result in fines to the organization or the individual. So Section 57 states, if because of conduct in the opinion of the employer is unprofessional conduct, the employment of a regulated member is terminated or suspended, or the regulated member resigns, the employer must give notice of the conduct to the complaints director. So the interpretation of that is if the person just quits to avoid having a complaint pursued against them, that doesn't get the employer off the hook for reporting it to the college. You're also obligated under the Code of Ethical Conduct to report and address unprofessional, incompetent practice of any healthcare provider. So the Code of Ethical Conduct reads that members be professionally and morally responsible for addressing incompetent, unsafe, illegal, or unethical practice of any healthcare provider, and legally responsible for reporting the conduct that puts a client at risk to the appropriate authorities. So there is a responsibility, there is a duty to report on 2 levels.
Scenario number 5. Would you say this is the majority scenario?
Yes.
Yes. The physiotherapist intern passed the PCE. What happens now?
So although you find out that the physiotherapist intern has passed the exam, this does not end your supervisory responsibilities quite yet. You are obligated to continue providing supervision until the physiotherapist intern is on the general register. This usually takes Physiotherapy Alberta staff about 7 to 10 business days after the results are released to make the switch from getting them from the provisional to the general register, in large part just because of the volumes that we're dealing with at any exam administration. And just so you know that we get the results at the same time that the physiotherapist intern does, so that you can start getting an idea about what the time frame is.
So let's go back to the scenario that Moyra presented at the start of the presentation. We've covered many of the components that were identified.
I thought you were going to do this.
Whoops. Technical difficulties. So it's a physiotherapist intern. That intern has been foreign trained and registered and has practiced for a number of years in their country of origin. They're going to be working in a rural facility and there's no on-site supervision. The supervisor is a 30-minute drive away, that's you, and you only work part-time. The documentation is in paper format. There's a severe shortage of physiotherapists and limited access to physiotherapists in the area. The employer has directed you, the supervisor, to sign the supervision agreement. None of these factors are insurmountable, but all of them combined makes for a challenging supervision environment. The supervisor will need to plan carefully to make sure that they are providing appropriate supervision. Moyra?
So sometimes the supervisor may feel, particularly with a foreign-trained, experienced physiotherapist, that it's not my place to question treatment techniques that are not typical of Canadian practice. Particularly, as I said, if the physiotherapist intern is an experienced practitioner in their country of origin. This sentiment is in opposition to the supervision agreement that the supervisor signs and the expectations of Physiotherapy Alberta. It's the supervisor's responsibility to provide adequate supervision and ensure safe, competent patient care relative to Physiotherapy Alberta's standards of practice, code of ethical conduct, and all applicable legislation. The litmus test for this would be that if you were called to a hearing tribunal, either in the case of a physiotherapist intern or against your responsibilities, would you be able to defend your action or inaction? It's not about what the college thinks. It's not about what the standards say specifically. It's about what a group of your peers would consider reasonable practice.
When thinking about this, we identified that there's probably 3 types of physiotherapist interns in a broad sense. There's the standard intern, the underperformer, and the overconfident intern. How do you manage each? If you're lucky to have a standard intern, well, lucky you. You still need to help them to successfully enter into autonomous practice in Canada. That's what this whole supervision thing is about. But you might have an easy run of it. When it comes to, or an easier run of it, I should say. When it comes to the underperformer, you need to consider how you're providing supervision. Talk to your peers and get help from them, and perhaps even tell it like it is. After all, context matters. Maybe it's not so much about the intern or their performance. Maybe this just isn't the right job for them, the right work environment, the right patient population. When thinking about the overconfident intern, you have to realize that that's often as challenging as the underperformer. They think they know what they don't know. They need frequent check-ins to ensure that they truly understand what's going on, that their clinical reasoning is sound, and that they're using appropriate techniques and sound judgment in the approach to patient care. What do Physiotherapy Alberta's expectations mean to you? Well, each supervision relationship begins with a period of assessment so that the physiotherapist assigning care knows what they can and cannot safely assign. The supervising PT needs to ensure appropriate assignment of services. They need to provide appropriate supervision, whether it be direct or indirect. Again, that depends on the patient population, the intern's competence, and other contextual factors. Ongoing communication and regular reassessment are required. In short, make a plan and follow it. Communication is key. Not only is it a requirement of the standards of practice, but formal and informal communication makes care safer and improves the quality of care delivery. It also helps to create an environment where communication enables all team members to raise concerns and issues.
So how do I benefit? Again, there's some scary stuff in there, but for the most part, these are very positive relationships. And it's important to bear that in mind. So how do I benefit from being a supervisor? Because it's a wonderful way for staff recruitment. You benefit personally in your professional development, and it is a service to the profession.
Sum up. Physiotherapy Alberta's supervision framework is designed to be flexible so that it will apply in many different settings and contexts. We rely on supervisors to use their professional judgment to apply appropriate supervision. Physiotherapy Alberta has tools and supports to enable you to be successful. The balance we're striking is between public protection and allowing the intern to enter practice. The other option would be to require these individuals to successfully complete both components of the PCE and be admitted to the general register before they could enter into practice. That scenario doesn't serve the profession, it doesn't serve our patients, and it certainly doesn't serve the new registrants. So we've come to the end of our formal presentation, but we're more than happy to take any questions. I would like to remind you that Physiotherapy Alberta's Practice Advisor is also available to help you through challenging situations or address questions that may come up as you enter into supervisory relationships. And so with that, we'll move to our Q&A. We do have a few questions already in the chat pod, but if you would, please go ahead and type in any additional questions that have arisen. That would be great. So the first question, it comes from a clinician, and I'm just going to read it here. So the question is, if a physiotherapist employs an intern in their clinic, what is the expectation from the supervising physiotherapist in regards to being available during the intern's working hours? So again, that goes back to, really, it depends. So if the supervising physiotherapist feels that the supervisee can practice with indirect supervision, and they've put in place indirect supervision methods that enable appropriate supervision, then you wouldn't necessarily have to be available during their working hours. You should have some sort of a contingency plan for what happens if an emergency arises when the intern is there and you are not. So they have a way to contact you or someone else, a designated person for those emergencies. But if the intern's doing well and you're indirectly supervising, that may be completely acceptable. On the other hand, if the intern is struggling and you're not prepared to let them practice with indirect supervision, or if the intern is practicing a basic restricted activity, you must be on site providing direct supervision. Anything to add from either of you? No? And our next question from Tony. Tony asks, if the intern is a casual employee in a large hospital and the intern decides to work in another program than the supervisor, does the intern need a new supervisor at the program? If so, does the intern provide a new agreement to the college? I would say that yes, a new supervision agreement should be in place. And the reason is really comes down to the competence of the supervisor. So one of the standard statements in the standard, and forgive me if I don't say the wording exactly perfectly, but one of the standard statements says that you only supervise activities that you yourself are competent to perform. So if the supervisee is working in a program that you have no contact with and maybe are of limited experience in, then the supervisor should really be in the program that the supervisee is working in. Similarly, if they're in a different program, that may create a structural barrier to your ability to supervise them appropriately. So just by virtue of the fact that they're somewhere else in the building of this large hospital, that may prevent you from being able to supervise adequately. So yes, I'd suggest that the intern provide a new agreement to the college and a supervisor from within that program. Sarah asks, I live in a rural area and rent out my rooms. I assume that would be, you know what, Sarah, I'm not entirely sure what your question is. Are you talking about treatment rooms, or are you talking about a room in your home for your student? So I will have you type in and respond to my question and get back to me so we can clarify your answer. I have a question from Diane. If reporting under Section 57, Does the supervisor or employer, need to reference one aspect of unprofessional conduct, or does the college figure that out based on the report?
Generally what would happen is that the employer would provide the college with the termination letter. They don't need to specifically state. It's generally quite clear. The reasons for termination from an employer can range. They can be personnel issues, or they can be professional issues, and that's really on the part of the college, the complaints director, to figure out how the termination relates to the standards of practice. In the complaints world, it all relates back to the Code of Ethical Conduct and the standards of practice. So they don't need to state in any specific format. They need to inform us. If it goes on to a formal investigation, the complaints director would follow up and would find out the background in the investigation process.
Okay, and Diane had another question. She's asking, one question that comes up from time to time is, why can interns not perform restricted activities, especially dry needling, if they were doing it outside of Canada? And I'm going to say that it's based on our legislation, although I'm sorry I can't cite the exact section of our legislation, but I believe it's in the Physical Therapist Profession Regulation. There's no provision within that regulation that allows anyone other than a member on the General Register to perform advanced restricted activities. So it is a wording within the PTPR that creates that restriction. And so they do need to wait until they're a member on the General Register before the physiotherapist intern can either engage in the activity, which to do so they'd have to apply for authorization, let's remember, or to engage in a program of study. And I bring that up because part of programs of study, especially around needling and manipulation, which are advanced restricted activities, almost always, well, they do always include a practical component where you're practicing the activity on another human being. And that's the stumbling block, is that you can't practice that activity on another human being until you're on the General Register, even in an educational context. So hopefully that answered your question, Diane. Carol asks, are you required to maintain the supervisor agreement until the intern passes the PCE, no matter how long it takes? Joyce?
Well, yes, if you are a party to the supervision agreement until the individual transfers over to the General Register or you withdraw as a supervisor.
In other words, not necessarily if you choose to withdraw. Is there a limited time period until the the candidate, I'll ask that question differently. What is the time frame that a candidate has to successfully complete the PCE?
Right, so I'll speak to how long they can be on the provisional register. So an individual may stay on the provisional register for up to 2 years. And within that time frame, they have 2 opportunities to attempt and successfully complete the physiotherapy competency exam. And that is for the most part. Our legislation does have some provisions for extenuating circumstances. So if sometimes an individual could go a little bit beyond the 2 years or the 2 attempts, but those are in extenuating circumstances, and it is they're more rare than they are common.
Okay, and Sarah's written back and clarified her question. So this is really around renting out accommodation to a physiotherapist student. I think it's a potential conflict of interest. I don't know that I'd say it's a prohibited activity. I'm interested in hearing what Moyra and Joyce have to say about this. To me, realizing that in a rural area it may be very difficult to find accommodation, and that may make it difficult to have students come there, or be a barrier for students to go to, students in this case, to go to there, then, it may be reasonable to rent out a room. But on the other hand, you have to look at whether you're doing it to facilitate the placement or if you're doing it for purposes of financial gain only. So that would be my suggestion. Moyra, do you have any comments about that?
I just think that you need to go into that with caution, bearing in mind that, a student is it's a smaller risk because it's a set period of time. But if it is an intern that is hired into the facility, potentially, and something goes wrong, that could create a very uncomfortable situation for you. I would do it with caution, although it's not prohibited. It would be a cautionary activity.
And in fairness, that would be true also with a student, because after all, if you spend all day supervising a student, you might want a little space from each other in the evening, I would suggest. All right, so we are drawing to the end of our Q&A period, and usually when I say that, people start madly typing in, so I'm going to give you a few moments in case there are any other burning questions for people on the line. We did have one other question posed to us, and it is one that comes up really frequently, and it's about the difference between co-signing patient records of your physiotherapist intern and chart auditing. So when you are co-signing a chart, there's some pretty significant implication, and what we've come to understand as a college is that what that means is that your signature on that piece of paper says that you agree with everything that's documented on it and the accuracy and correctness of it. So if what you're actually doing is using chart auditing as a way to indicate that you're doing your supervision, you should, as a supervisor, be writing a note in the chart that says, chart audited on this date with your signature and the date of the audit. That makes it really clear that what you're doing is auditing. If you co-sign, there's a question mark about whether what you've done is audit the chart or if you were actually present in the room, able to validate all the findings that are documented in the chart. Hopefully that was clear, but if not, please give me a call. Another question that Carol asks is, can physiotherapist interns supervise others, TAs and PT students? So the answer, it depends on who you're there supervising. Physiotherapist interns can supervise therapy assistants. That would be part of the basic competencies of a PT intern, keeping in mind that the supervisor is responsible for supervising the intern. Follow this one carefully. Supervising the intern, who is then supervising the TA. So they're making sure that the intern is supervising the TA correctly, and ultimately they are responsible to do so. So it doesn't mean that the ultimate supervisor changes, but the intern can supervise and assign tasks to TAs. When it comes to physiotherapy students, I don't believe that they can. I think that would be probably pretty questionable. I'm not aware of any prohibitions from our legislation, but I'd be very surprised if the university would allow that to happen, given that the member's not on the general register. Is there any legislation you're aware of?
Not legislation, but that would be between the university and the individual doing the supervision.
Fair enough. Right. And Krista asks, what about student interns that are doing clinical practice weekly at another site with a PT and work for you as a PTA? Are there any PT duties that they're allowed to do while employed as a PTA, or must we be careful not to cross that line? So I'm assuming that you're referring to your comment about clinical practice weekly at another site makes me think that you're referring to your bridging program supervisees, but I could be wrong on that, Krista. But the bottom line from a practice advice perspective would be that your assignments must be appropriate to the competencies of the intern, or of the TA. So there are certain rules that are in place about things that cannot or must not be assigned to a TA, and you'll find those in the supervision standard. That's things like components of components of restricted activities, performing an assessment, what are the other ones, guys? Performing an assessment, analyzing the findings of the assessment to come up with a diagnosis and treatment plan, and discharge planning. Those activities are activities that can never be assigned to a TA. But if you have a highly competent individual working as a TA, you can assign tasks up to the limits of their competence, provided that you don't cross into those prohibited activities. And I hope I've answered your question. So the fact that they're a PT intern really is secondary to the fact that you're assigning based on their competence. That would be what I would say. And Joyce and Moyra, anything to add? Okay. All right. So at this time, I'm not seeing any further questions in the question and answer pod. So I think, unless we suddenly get a flurry of questions, we will draw this morning's presentation to a close. Thank you again for joining us for this presentation. Thank you to our speakers, Joyce and Moyra, for being here so bright and early. And we look forward to seeing you again in April for our next webinar session.